EMPAVELI, pegcetacoplan, is a prescription medicine used to treat adults with a disease called paroxysmal nocturnal hemoglobinuria, PNH. EMPAVELI may lower the ability of your immune system to fight infections. It increases your chance of getting serious infections caused by encapsulated bacteria including Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B. These serious infections may quickly become life-threatening or cause death if not recognized and treated early. You must complete or be up to date with the vaccines against Streptococcus pneumoniae and Neisseria meningitidis at least 2 weeks before your first dose of EMPAVELI.
I'm Andrea. I live in Massachusetts with my husband and our 15-year-old granddaughter. We love to take walks, and I guess our most favorite thing to do is to go to the Outer Banks every summer and relax and enjoy the water. It's beautiful down there. I was first diagnosed with aplastic anemia, and it took a number of doctors and finally a specialist who diagnosed my PNH. During that time, I had well over 13 transfusions of both red blood cells and platelets. When I was diagnosed with PNH, I did research, and when I read about it, I found that it didn't sound as bad as I was actually feeling, but I knew that I wanted to start treatment immediately. While I did have some improvements when I was on other PNH treatments, my hemoglobin levels were still below normal, and I was still requiring transfusions. It was then that the doctor and I had discussed other treatment options. And the biggest factor too was also, it was an all-day affair for me because the infusion center is a long ways away. So it was an all-day adventure. My doctor and I had discussed the clinical trials of EMPAVELI, and we thought it would improve my levels of hemoglobin and address my need for infusions. I could also self-infuse at home, which would save me the long trip back and forth to the infusion center. Also, we had talked about the safety information, including the risks for serious infection and my need to get vaccinations. I wanted to raise my hemoglobin levels and also not need to travel so far to the infusion center. I was nervous about sticking myself with a needle, but after I saw the size of the needle, it's really no bigger than the size of a pea. And with the training that I received from my Apellis care educator, who was wonderful, I was able to get the confidence and the ability to self-infuse at home. Although I still like to have my husband administer it for me, after he does that, I'm able to take it out. I no longer need transfusions, and my hemoglobin is consistently at 11.7. I did experience an adverse event of minor stomach pain, but after talking to my doctor, we talked about it, and now I travel with my EMPAVELI. It's kept at a safe temperature, and I follow my schedule. It doesn't hold me back from traveling, which is great. Talk to your doctor to find out what's right for you. Don't be afraid to ask questions, and most of all, be your own advocate.
EMPAVELI, pegcetacoplan, is a prescription medicine used to treat adults with a disease called paroxysmal nocturnal hemoglobinuria, PNH. EMPAVELI may lower the ability of your immune system to fight infections. It increases your chance of getting serious infections caused by encapsulated bacteria including Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B. These serious infections may quickly become life-threatening or cause death if not recognized and treated early. You must complete or be up to date with the vaccines against Streptococcus pneumoniae and Neisseria meningitidis at least 2 weeks before your first dose of EMPAVELI. If you have not completed your vaccines and your healthcare provider decides that urgent treatment with EMPAVELI is needed, you should receive the required vaccinations as soon as possible. You should also receive antibiotics to take for as long as your healthcare provider tells you. If you have been vaccinated against these bacteria in the past, your healthcare provider will decide if you need additional vaccinations before starting EMPAVELI. Vaccines do not prevent all infections caused by encapsulated bacteria. Call your healthcare provider or get emergency medical care right away if you get any of these signs and symptoms of a serious infection. Fever, with or without shivers of the chills. Fever with chest pain and cough. Fever with high heart rate. Headache and a fever. Confusion. Clammy skin. Fever and a rash. Fever with breathlessness or fast breathing. Headache with nausea or vomiting. Headache with a stiff neck or stiff back. Body aches with flu-like symptoms. Eyes sensitive to light. Your healthcare provider will give you a patient safety card about the risk of serious infections. Carry it with you at all times during treatment and for 2 months after your last EMPAVELI dose. Your risk of serious infections may continue for several weeks after your last dose of EMPAVELI. It is important to show this card to any healthcare provider who treats you to help them diagnose and treat you quickly. EMPAVELI is only available through a program called the EMPAVELI Risk Evaluation and Mitigation Strategy, REMS. Before you can take EMPAVELI, your healthcare provider must counsel you about the risk of serious infections caused by certain bacteria, give you information about the symptoms of serious infections, give you a patient safety card about your risk of serious infections, and make sure that you are vaccinated against serious infections caused by encapsulated bacteria and that you receive antibiotics if you need to start EMPAVELI right away and you are not up to date on your vaccines. Do not take EMPAVELI if you are allergic to pegcetacoplan or any of the ingredients in EMPAVELI. Have a serious infection caused by encapsulated bacteria, including Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B when you are starting EMPAVELI treatment. Before starting EMPAVELI, tell your healthcare provider if you have an infection or fever, are pregnant or plan to become pregnant. EMPAVELI may harm your unborn baby. Females who are able to become pregnant should have a pregnancy test before starting treatment and use an effective method of birth control during treatment with EMPAVELI and for 40 days after the last dose. Are breastfeeding or plan to breastfeed? You should not breastfeed during treatment with EMPAVELI and for 40 days after the last dose. Tell your healthcare provider about all the vaccines you receive and medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements which could affect your treatment. If you stop taking EMPAVELI, your healthcare provider will need to monitor you closely for at least 8 weeks after stopping EMPAVELI. Stopping treatment with EMPAVELI may cause a breakdown of red blood cells due to PNH. Allergic reactions can happen during your EMPAVELI infusion. Stop your EMPAVELI infusion and tell your healthcare provider or get emergency medical care right away if you get any of these symptoms during your EMPAVELI infusion. Chest pain, trouble breathing or shortness of breath, wheezing, swelling of your face, tongue, or throat, feel dizzy or faint or pass out, fast heart rate, nausea or vomiting, feel confused or anxious, skin reactions including rash, hives, and itching. The most common side effects of EMPAVELI are injection site reactions, infections, diarrhea, pain in the stomach, abdomen, respiratory tract infection, pain in the arms, hands, legs, or feet, low potassium in blood, tiredness, viral infection, cough, joint pain, dizziness, headache, and rash. These are not all the possible side effects of EMPAVELI. Be sure to tell your healthcare provider about any side effect that bothers you or that does not go away. For more information, ask your healthcare provider. Talk to your doctor for information on EMPAVELI. Please see important safety information, including boxed warning regarding risk of serious infections and the full prescribing information and medication guide at empaveli.com.